Hey guys, Dr. Walker from DentalWalker.com. Welcome back to the channel. Today I'll talk a little about one of the complications of proton pump inhibitors, PPIs they're called. So remember that your body needs to have a very low pH for you to extract things, magnesium, potassium, from your food, right? So if the pH of the stomach is too high, as it would be with a proton pump inhibitor, gets you up to about 6. The typical pH of the gut is maybe 1.2 or 1.5 thereabouts. It needs to be that low for it to be able to process the foods you've eaten and extract all of those good things from your food. If the pH is too high, then you run the risk of long-term complications. Again, one of those complications is going to be osteoporosis and osteopenia. So I can almost predict for you that if you're on these pills twice a day, once a day, for 10 years, your doctor will be surprised, they shouldn't be, in 10 years, 15 years down the road, when you, at 50 years old, become osteopenic or osteoporotic. Then they'll say, oh my God, why are you osteopenic, osteoporotic? Well, because you gave them long-term use of a PPI, right? That's the reason for, and not the only reason, but that's a huge reason for having a person become osteopenic long-term. They'll give you a suggestion of calcium carbonate. Calcium carbonate, again, a little tiny rock that not much of it gets absorbed, maybe 20% thereabouts, right? And they do. They have a whole other list of things that they can give you if you become osteoporotic or osteopenic. When the initial premise for you taking it, heartburn typically, reflux typically, all you had to do from the beginning is have a discussion with the person to say, hey, you really have a choice. You can either remove these foods as offending your body, typically high-carb foods, tomato products, tomato paste, tomato sauce, fried foods, greasy food, fatty foods, right? You can typically remove those things or reduce them from your food list, or have the heartburn, right? Because if you take these pills long-term, they're going to prevent you from extracting those minerals from your food that your body needs. And long term, if you're not having enough magnesium, calcium, potassium, and all those things, long term there will be consequences. So really, you either remove some of these foods, or you can take these pills, but the long term consequences are going to be all of these other problems. And that's just kind of one part of the problem, right? So if I said before in my last video, if you're reducing potassium, for example, you're going to have peripheral nerve issues, you're going to have mentation issues, focus issues, you're going to have numbness and tingliness, muscle aches, muscle pain, twitches, tremors, right? All those things you can get with like a potassium disorder. And magnesium, for example, is the other one, right? 300 plus different enzymatic reactions in your body that you're not going to be adequately supplying because your magnesium levels are low. And the initial cause of that is going to be you're on a proton pump inhibitor, which by default, by definition, is going to prevent those things from being extracted from your food. It's just how it works, right? It's almost criminal, in my mind, if a person's on a PPI for all those years. I had one guy 25 years on a PPI, right? Your body needs those things that I just mentioned. It needs them. And if you're on a PPI long term, it prevents or reduces them significantly from being absorbed by your system, which you so need, right? If you have heartburn, I said before, you can take a little bit of baking soda, like a half a glass of baking soda with a teaspoon of that, or you can take a couple of capsules of apple cider vinegar in some water, and then that will reduce the heartburn that you have. But the goal really should be that you watch your diet, have a food list, figure out which food piss off your gut, and if they do, then either remove them from your diet or have them much earlier in the day so they're not having a problem towards the end of the day. But if you have a big pulled pork sandwich, or you have, some fries, sometimes French fries, or you have a big greasy burger, right, at 6, and you go to bed at 7, it will cause you some problem. But again, the answer is not for you to take a PPI, proton pump inhibitor, because it's going to prevent a lot of things from being absorbed by your body. It's just how it works, by your body, right? And they work, and they do work. They work upwards of 24 hours. In other words, up to 24 hours, your body will have the inability to extract all of those nutrients from your food. It's just how it works. If you have a problem with osteoporosis or osteopenia, the goal is not calcium carbonate again. It's not, because again, 20% of that gets absorbed. The goal is to maximize your vitamin D, K2, and magnesium. Maximize those things. Maximize your calcium-based foods I mentioned before: bok choy, spinach, broccoli, right? Lots of salmon, sardines, right? All of those things have really high calcium base in them, right? Maximize vitamin D, in K2 and magnesium, and you will absorb lots of calcium from that standpoint, keeping your system adequate and high. But again, remember that PPIs are going to prevent all of those things, your magnesium, potassium, calcium, from being broken down from your food that you've eaten, and for your body to use those things. And long term, it'll cause you problems that you are not even beginning to think about yet, right? Anyway, thanks for listening, Dr. Walker.